Bonjour tout le monde et bienvenue à l'Université d'Ottawa. Mon nom est Lucie Thibault et je suis la doyenne de la Faculté des sciences de la santé ici à l'Université d'Ottawa. L'École des sciences infirmières est partie intégrante de notre faculté. Dear Minister Duclos, Minister Fortier, Dr. Chapman, Dr. Brousseau et Madame Nowgesic, on behalf of Monsieur Jacques Frémont, President of the University of Ottawa, I am very pleased to welcome you today to this very important announcement. Whenever we gather at the university, particularly for such an important event, it is our custom to reflect on the university's relationship with Indigenous peoples. Nous rendons hommage au peuple algonquin, gardien traditionnel de cette terre. Nous reconnaissons le lien sacré de longue date, l'unissant à ce territoire qui demeure toujours non cédé. Nous rendons également hommage à toutes les personnes autochtones qui habitent Ottawa, qu'elles soient de la région ou d'ailleurs au Canada. Nous reconnaissons également les gardiennes et gardiens des savoirs traditionnels de tout âge. Nous honorons aussi leurs dirigeantes et dirigeants d'hier, d'aujourd'hui et de demain, au courage indéniable. We pay respect to the Algonquin people who are the traditional guardians of this land. We acknowledge their long-standing relationship to this territory, which remains unceded. We pay respect to all Indigenous people in this region, from all nations across Canada who call Ottawa home. We acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders, past, present, and future. In 2 weeks, a new cohort of nursing students will begin their studies here at the University of Ottawa and everywhere across Canada. The announcement today acknowledges the essential contributions of nursing and the need for voices of nurses to be at the table, and I will encourage our students in our faculty and in our School of Nursing, who are the next generation of nurses, to take on leadership role and provide policy directions to help enhance the healthcare system. Welcome once again, Minister Duclos, et je cède maintenant la parole au ministre Fortier.
Et c'est un énorme plaisir de vous accueillir dans la circonscription d'Ottawa-Vanier aujourd'hui. Je veux commencer par quand même reconnaître que nous sommes ici situés sur le territoire traditionnel non cédé du peuple algonquin Anishinaabeg pour l'événement d'aujourd'hui. Et oui, je m'appelle Mona Fortier, présidente du Conseil du Trésor et fière députée d'Ottawa-Vanier. Et je suis particulièrement fière d'être ici, de retour à mon alma mater, en compagnie de mon collègue, le ministre de la Santé, Jean-Yves Duclos, pour cette importante annonce. Et je veux remercier l'Université d'Ottawa qui a gracieusement accepté de nous accueillir ici au Pavillon des Marais. Et je sais que c'est une période de l'année très occupée pour vous, alors que vous vous préparez à accueillir les étudiants de retour en classe très prochainement. Alors, merci pour tout votre travail que vous faites pour les accueillir. Alors, nous sommes ici aujourd'hui pour accueillir et partager d'excellentes nouvelles pour les infirmières et la profession infirmière ici au Canada. C'est important parce que le personnel infirmier constitue le plus grand groupe de fournisseurs de soins de santé au Canada. Et nous dépendons tous de ces professionnels pour prendre soin de nous dans les moments les plus difficiles. Et on sait très bien au cours des dernières années, on a mis beaucoup de pression sur ces infirmières et ces infirmiers. Et je veux remercier nos héros que nous avons depuis plusieurs années, surtout avec la question de la COVID. And we're fortunate to be joined today by Monsieur Sylvain Brousseau, the President of the Canadian Nurses Association, and also Marilee Nowgesic, Chief Executive Officer of the Canadian Indigenous Nurses Association. And we will hear from both of them, both distinguished guests, a little bit later. I do want to acknowledge also the participation today of Jean-Daniel Jacob, Director of the School of Nursing, and also Lucie Thibault, Dean of the Faculty of Health Services. Thank you very much for being here. And also Professor Phillips, who I just met, the President of Canadian Associations of Nurses and Aides. Thank you very much for that earlier conversation. Now, I want to introduce you all to my colleague, Jean-Yves Duclos, the Minister of Health. He is a well-published author, conference speaker, and economics expert with a long and distinguished career as an academic. And before entering politics, he was the director of the Department of Economics and a tenured professor at Université Laval. In 2014, he was elected a Fellow of the Royal Society of Canada, the highest accolade bestowed upon Canadian researchers. And therefore, we're fortunate to have his expertise in the federal cabinet, where he preceded me as president of the Treasury Board after serving as Minister of Families, Children, and Social Development. Now, last October, as you know, Minister Duclos took on a whole new set of challenges as Canada's new Minister of Health. And he has an ambitious agenda to create a new Canada mental health transfer, launch a new dental care program for low-income Canadians, make long-term care safer, and speed access to critical services. And that's just to name a few of his goals and objectives. Now, I have to say his leadership has been invaluable to navigating the pandemic, protecting Canadians' health and the lives of the most vulnerable. Ladies and gentlemen, please join me in welcoming my colleague, Jean-Yves Duclos, the Minister of Health.
Bonjour à tous. Good morning, everyone. Merci, Mona. C'est effectivement une grande chance d'être ici ce matin en si bonne compagnie. J'aimerais particulièrement remercier, comme vous l'avez fait, la doyenne Lucie Thibault de nous accueillir ici à l'Université d'Ottawa avec beaucoup de vos collègues. L'Université d'Ottawa étant aussi mon alma mater, une de mes alma mater. I also want to extend a big welcome to the nurses and healthcare workers joining us here today and virtually, including those represented by the Canadian Nurses Association and the Canadian Indigenous Nurses Association. Thank you, Marilee and Sylvain, for being with us. En tant que plus grand groupe de professionnels de la santé réglementés au Canada, avec plus de 400 000 membres, les infirmières et infirmiers sont essentiels au système de soins de santé au pays. Le travail que vous accomplissez au service de nos concitoyens est essentiel, mais on sait aussi qu'il est physiquement et émotionnellement exigeant. Les Canadiens sont à juste titre très reconnaissants d'avoir des professionnels de santé engagés comme vous, qui s'occupent de leur santé, qui prennent soin d'eux et de leurs proches. Merci beaucoup pour tout ce que vous faites au nom de tous et de toutes. À l'heure actuelle, de nombreux travailleurs de la santé, y compris les infirmières, sont confrontés à d'immenses pressions dues à la pandémie de la COVID-19, à l'augmentation de la charge de travail et à la pénurie de personnel. Nous savons qu'il existe des problèmes de longue date qui se sont aggravés au cours des 2 dernières années. Une enquête récente de Statistique Canada montre, entre autres, que la plupart des travailleurs de la santé, dont 97% des infirmières, connaissent maintenant des niveaux de stress et d'anxiété plus élevés en raison de la pandémie. Cette situation a des répercussions non seulement sur le moral de ces personnes, mais aussi sur la capacité de ces gens à servir les patients dans notre système de soins de santé. In fact, there are already a number of jurisdictions in Canada reporting nursing shortages, which is having an impact on the functioning of emergency rooms and other critical health services that Canadians need and deserve. With this growing crisis, we need to support our nurses, make sure they are heard and that their challenges are met with solutions. We need the right advice and expertise to inform our path forward. And that's why we are here today. Our government recognizes that people on the front lines can bring valuable insight and expertise to inform the design of national policies and programs. We have heard the call from organizations representing nurses across our country, including those present here today, like the Canadian Nurses Association and the Canadian Indigenous Nurses Association. In February, we launched the process for reinstating the role of a Chief Nursing Officer, a voice for nurses at the federal level. Today, I am very pleased to announce the appointment of Dr. Leigh Chapman for this essential key role. Dr. Chapman is a registered nurse who received her PhD from the University of Toronto's Lawrence Bloomberg Faculty of Nursing. She has close to 20 years of leadership experience in varied nursing environments, including positions in home and community care, research, academic, policy, regulatory, and professional practice environments. As Canada's Chief Nursing Officer, Dr. Chapman will provide strategic advice from a nursing perspective to Health Canada, participate in the development of broad health policy, and represent the Government of Canada at public forums, both within Canada and internationally. Her valuable input will inform our government's work in our collaboration with provinces and territories to grow the healthcare workforce in line with the healthcare priorities I announced earlier this year at the nursing school just nearby. Permettez-moi de le dire en français. Notre gouvernement reconnaît la valeur de l'expertise des travailleurs de première ligne. Leur vécu doit nous guider dans l'élaboration des politiques et programmes à l'échelle du pays. Nous avons entendu l'appel des organisations représentant les infirmières et les infirmiers à travers le pays, y compris celles qui sont ici avec nous aujourd'hui, comme l'Association des infirmières et des infirmiers du Canada et l'Association des infirmières et infirmiers autochtones du Canada. En février, nous avons lancé le processus visant à rétablir le rôle d'infirmière en chef, une voix pour les infirmières et infirmiers au niveau fédéral. Aujourd'hui, j'ai le grand plaisir d'annoncer la nomination de la Dr. Leigh Chapman dans ce rôle clé important. Madame Chapman est une infirmière qui a obtenu son doctorat à la Faculté des sciences infirmières Lawrence Bloomberg de l'Université de Toronto. Elle possède plus de 20 ans d'expérience en leadership dans différents secteurs des soins infirmiers, y compris dans des postes dans les domaines des soins à domicile et communautaires, de la recherche, de l'enseignement, des politiques, de la réglementation et de la pratique professionnelle. En tant qu'infirmière en chef du Canada, la Dr. Chapman fournira à Santé Canada des conseils stratégiques du point de vue des soins infirmiers, participera à l'élaboration de la politique générale en matière de système de santé et représentera le gouvernement du Canada lors de forums publics tant au pays qu'à l'étranger. Cette précieuse contribution éclairera le travail du gouvernement canadien et sa collaboration importante avec les provinces et les territoires en vue d'accroître et de soutenir la main-d'œuvre dans le secteur des soins de santé, conformément aux priorités en soins de santé que j'ai énoncées un peu plus tôt cette année à l'École des soins infirmiers, tout près d'ici. In conclusion, improving our healthcare system includes addressing the shortages of healthcare workers we are seeing across the country, and nurses are an integral element of that response. I'd like to share with you a quote from Florence Nightingale, the founder of modern nursing. May we hope that when we are all dead and gone, leaders will arise who have been personally experienced in the hard, practical work, the difficulties and the joys of organizing nursing reforms, and who will lead far beyond anything we have done. Well, I'm confident Dr. Chapman will be an excellent leader in this context, as envisioned by Ms. Nightingale. We all look forward to learning from Dr. Chapman's extensive experience and insight. And as we mark a new beginning for collaboration and cooperation with stakeholders at all levels, I am very confident that she will increase the visibility, the input, and the influence of Canada's nurses at the national level. Together, along with our partners in provinces and territories, she will help us continue to address the critical issues that are affecting nurses and nursing across Canada right now, while we work on the 5 areas of priorities that we have identified commonly. A, reducing backlogs and supporting our healthcare workers, and particularly nurses. B, enhancing access to family health services and primary care. C, improving mental health and substance use services. D, helping Canadians age with dignity closer to home. And E, using health data and virtual care to support healthcare workers. By focusing on these key areas, we will continue to deliver results in the best interest of all. Ensemble, avec les provinces et les territoires, nous avons le devoir de traiter des problèmes critiques qui affectent directement et durement les infirmières et les infirmiers partout au pays. Et nous avons bien hâte de profiter de l'expérience de la Dr. Chapman pour y arriver. Merci. Thank you. Miigwech.
Merci, Monsieur le Ministre Duclos, pour cette chaleureuse présentation. It is with great pleasure that I accept the appointment as the Federal Chief Nursing Officer. I'd like to thank all of those who supported the reinstatement of this important role. Your commitment in supporting the need for a federal nursing voice, as well as advocating on the critical issues facing nurses today in Canada, is noteworthy. Nurses make up Canada's largest group of regulated health professionals. I look forward to providing a strong nursing voice for all nurses and increasing the visibility of nurses at the national level. To do so, collaboration will be key. Nursing stakeholders such as our colleagues here today from the Canadian Nurses Association, the Canadian Indigenous Nurses Association, and the Canadian Association of Schools of Nursing play a crucial role in ensuring nursing in Canada meets the highest standards of care. I look forward to collaborating with educators, with regulators, and frontline nurses, among others, to strengthen the sector for both patients and nurses alike. I firmly believe that nurses make a difference in the lives of their patients and the healthcare system overall. Throughout my experience in acute care settings, as well as in the community and in academic settings, I've seen firsthand the difference that nurses make. Nurses also work closely with other healthcare professionals, such as therapists, and implement innovative technologies to improve patient outcomes. Supporting patient care puts us in a unique position in the team of healthcare providers to bring forward the patient voice. I recognize that there is significant work to do from a nursing perspective to ensure that we contribute to an accessible and safe healthcare system for all Canadians. I have a deep commitment to health equity and building a healthcare system reflective of all Canadians, especially marginalized and vulnerable populations. I'm humbled to have the opportunity to learn from and work with diverse groups to ensure their voices are heard. This includes those from Indigenous communities, racialized people, and Two-Spirit LGBTQ groups. I once again thank you for this opportunity and look forward to working collaboratively with you to strengthen the health system and the nursing profession in Canada. Thank you. Miigwech. Merci.
Alors, merci, Monsieur le ministre Duclos et Madame la ministre Fortier. Bonjour à tous. Good day, everyone. I would like to first acknowledge that I am speaking from the traditional lands of the Algonquin and Anishinaabe people. C'est avec grand plaisir que je félicite Dr. Leigh Chapman pour sa nomination en tant qu'infirmière-chef du Canada. Nous avons très hâte de découvrir les nombreuses réalisations et contributions significatives qu'elle fera pour la santé de tous les Canadiens et Canadiennes. This is an historical day for nursing in Canada. For many years, the Canadian Nurses Association and nurses across the country has been calling for the reinstatement of the Chief Nursing Officer, and we applaud the federal government for this significant decision. This appointment could not have come at a better time. Nurses have shouldered the enormous burden of the pandemic. Across the country, we are witnessing severe nursing shortage that threaten the sustainability of our healthcare system. Le rétablissement de la fonction de l'infirmière en chef envoie un message fort à toutes les infirmières et tous les infirmiers, à savoir que le gouvernement fédéral reconnaît leur rôle essentiel dans les soins et services de santé au pays. Nurses are present at every level of the healthcare system, and they are vital to the health policy development. Strengthening nursing leadership, such as the reappointment of the Chief Nursing Officer, will greatly contribute to health system transformation and improving access to care across the country. The Canadian Nurses Association looks forward to working with Dr. Chapman in her new capacity. Thank you. Encore toutes mes félicitations, Dr. Chapman.
Thank you very much, everyone. I'd like to first of all acknowledge the territory that I'm on and thank the ancestors for bringing me here to be a part of this with you today and to celebrate and congratulate Dr. Leigh Chapman in her new position as the Chief Nursing Officer. I am Marilee Nowgesic, Chief Executive Officer with the Canadian Indigenous Nurses Association. CINA is the longest standing Indigenous health organization in the country, now reaching 48 years. In that 48 years, we have been the voice of First Nations, Inuit, and Métis nurses across the country. To this time, we know that we roughly have 10,000 Indigenous nurses from coast to coast to coast. However, we look forward to working with the federal departments in identifying how we're going to address the issues of the critical need to increase the numbers, to sustain retention, and to develop recruitment. I look forward to working with my colleagues at the nursing lead organizations, but more importantly, Canadian Association of Schools of Nursing, Canadian Nurses Association, and all of the nursing faculties across the country. This is an exciting time to be in Indigenous health across the country. This is an exciting time to become a nurse in this country. This is an exciting time to blend traditional approach with Western trained credentials. This is an exciting time to share our knowledge with our allies, our partners, and our nursing lead organizations. We're looking forward to working with the CNO in developing and furthering CINA's strategic vision as we move forward to our 50th year and hopefully to another 50 years. We look forward to hopefully returning Northern clinical programs, to returning the traditional knowledge to our Indigenous nurses and our non-Indigenous nurses. This is an exciting time because, as I said many times before, and my colleagues in the room will recognize it, we look forward to working with the calls to action under the Truth and Reconciliation Commission's report. Indigenous people have nothing to reconcile, but we will be with you at the table to addressing those needs, addressing those goals, and obtaining the objectives with you. We look forward to the blend of traditional knowledge, traditional nursing knowledge, and the use of that knowledge in nursing practice, which will help lead to also Indigenous nursing research. We look forward to the introduction of Indigenous language into healthcare systems. Very basic knowledge. And if you can also develop it into the technological sense, we look forward to that too. We look forward to working with our nursing leaders, to working on the unique identifiers that allow for Indigenous nurses, whether it's in the workplace, at school, in an association, a union, to come forward and identify yourself. We look forward to working with our allied partners in addressing those identifiers. We are looking forward to and working with our federal partners, provincial and territorial partners, in addressing racism in the healthcare system. And a lot of those things will involve education, training, and Indigenous nursing knowledge. It is our place. We are the front line. We are the heart of the community. We are the pulse of what is going to become a better healthcare delivery outcome with our people. We look forward to reporting these outcomes with the national Indigenous organizations, the Assembly of First Nations, the Inuit Tapiriit Kanatami, and the Métis National Council Canada. Within their health portfolios, the information and the developments that we'll make with our partners at this table and moving forward will be exciting. Thank you again for this opportunity. Merci beaucoup.
Dylan Robertson with the Winnipeg Free Press. Minister Duclos, why is there still no date set for a Premier Summit on healthcare? And is this going to happen before the Quebec election, or are you waiting for that?
Well, that's a good question. I'm meeting again my colleagues this afternoon. We've been working for many months now on recognizing the healthcare crisis, and much of it obviously surrounds the crisis that healthcare workers are facing every day, mentally and physically. And today's announcement is key in that respect. I think we all heard clearly from various people how important it is to recognize that this crisis impacts directly our healthcare workers and their ability to serve patients. So it's all about, and almost all about, people and workers in particular. And with the forthcoming contribution of Dr. Chapman, I'm going to have, at the federal level, better support to engage the voice and hear the voice of nurses when it comes to developing the Pan-Canadian Health Human Resources agenda that we have been developing over the last few weeks and months, and which we are going to speak again today together at the Health Ministers meeting this afternoon. So it's all very, very timely, this question. The new chief nursing officer here present is going to play a key role in that regard. We are going to be able to count on her engagement, efforts, and abilities to bring people together, because we are going through a crisis and we need to acknowledge it and address it.
This question was about premiers, not health ministers, but my follow-up question is the Saskatchewan government is transferring hip and knee surgeries to Alberta, not paying for patient travel. Does this violate the Canada Health Act?
We have a joint responsibility, health ministers, and that joint responsibility is to acknowledge that the actual management of the healthcare system is a responsibility and a jurisdiction of provinces and territories, and no Canadian health minister should ever be ambiguous as to how, in practice, my colleagues from provinces and territories will manage the healthcare system. This being said, we have a joint responsibility to make sure that the Canadian Health Act's principles are met. And we all agree on the importance of these principles. And among these 5 principles, there are 2 key ones: universality and accessibility. And regardless of how we manage healthcare systems in Canada, we have to make sure that our system remains universal and accessible. That involves, obviously, accessible through no payments. No, people cannot pay for the basic insured health services that they need and deserve. That's something on which we all agree. So as we work together, we'll make sure that these principles are respected and that our common efforts are towards the resources, including financial resources that are needed to serve Canadians to the best of our abilities.
Tout le monde, Olivier Ferron-Boissé de TVA. J'aimerais savoir, est-ce que c'est chiffré les coûts de cette nouvelle fonction-là? Est-ce qu'on sait, par exemple, le nombre de ressources que ça va nécessiter? Quel budget Mme Chapman aura pour bâtir une équipe? Peut-être Mme Fortier ou M. Duclos?
Je peux peut-être répondre pour commencer. Tout d'abord, Mme Chapman s'intègre dans une équipe qui est déjà très solide. Donc, les ressources sont déjà là. Mais le problème, c'est que les ressources ont besoin d'être non seulement solides à l'interne, mais solides en lien avec tous les partenaires qui sont capables de nous appuyer dans le contexte de cette collaboration avec les provinces et les territoires qui est essentielle pour reconnaître et traiter de la crise en soins de santé que nous vivons présentement. Donc, son poste est nouveau, mais ce qui n'est pas nouveau, c'est l'infrastructure dans laquelle la ministre, pas la ministre, mais l'infirmière en chef Chapman, qui va être presque une ministre parce qu'elle va souvent me voir et m'entendre, et surtout, je vais souvent l'écouter. Alors, donc, on va travailler beaucoup ensemble, mais tout ça vient avec un budget dont je ne connais pas exactement les montants, mais on va demander à mon équipe de vous les fournir.
En suivi, pourquoi c'est important d'avoir ce poste-là d'un niveau national? Pourquoi pas simplement augmenter les transferts, par exemple, aux provinces pour qu'eux puissent aller chercher cette expertise-là de façon spécifique pour les besoins particuliers de leur province? Avez-vous confiance envers les provinces? Est-ce que c'est parce que vous n'avez pas confiance envers les provinces d'établir avec justesse ces orientations-là?
Deux raisons. La première, c'est 400 000. 400 000, c'est le nombre d'infirmières que l'on retrouve au Canada. Et c'est le corps professionnel en soins de santé le plus important. Non seulement en nombre, mais évidemment en impact sur la qualité des soins que reçoivent les gens. La deuxième raison, c'est que dans notre travail collectif entre les provinces, les territoires et le gouvernement canadien, l'enjeu principal, c'est comment on peut appuyer les travailleurs de la santé. Donc, en grand nombre, les infirmières et les infirmiers. Donc, moi, ça me prend au gouvernement canadien des gens crédibles et solides avec lesquels je peux travailler pour être le plus utile possible à mes collègues des ministres de la Santé. Moi, je suis un allié de mes collègues des ministres de la Santé des provinces et des territoires. Je suis là pour les aider. Alors, tous les outils dont je peux disposer pour les aider sont utiles. Et la présence de la Dr Chapman est un outil additionnel. Elle représente la voix, la force et l'influence de 400 000 infirmières et infirmiers au Canada. C'est très significatif dans le contexte de la crise que nous vivons présentement, mais aussi des perspectives majeures d'appui à nos travailleurs et à nos patients au cours des prochaines années. Au Canada, on sait ce qui s'en vient. C'est un vieillissement continu de la population, mais un vieillissement continu aussi de nos travailleurs de la santé. Nos travailleurs vieillissent aussi. On doit s'assurer non seulement d'en recruter davantage, non seulement d'en former davantage, non seulement de reconnaître les compétences de davantage de ces travailleurs, mais aussi de prendre soin de ceux et de celles qui sont là, de retenir les infirmières et les infirmiers qui font déjà le sacrifice personnel et professionnel d'être au service des patients maintenant. Donc, comment appuyer les travailleurs de la santé et les infirmières et les infirmiers maintenant? C'est un objectif majeur du travail de la Dr Chapman.
I wanted to ask specifically, Minister Duclos, what is the status of talks with premiers around increases to health transfers? Where are things at?
There are obviously two important connections that your question points to. The first is the results that we need to achieve, and the second is the tools that we need to achieve those results. I'm focused on results. In my conversations with my colleagues, health ministers across provinces and territories, we're focused on results. What are the results that we want to achieve to help healthcare workers and therefore to help patients? When I spoke earlier about reducing backlogs in treatments, in surgeries, and diagnostics, when I spoke about better mental health care services, better long-term care services, better palliative care services, better community care services, when I spoke about supporting family health teams and access to primary care. All that requires taking care of healthcare workers and nurses in particular. So much of that conversation around the results that we want to achieve is centered on healthcare workers. And that therefore leads to second question is, based on the results we want to achieve together, and again, we're having another meeting today specifically focused on that objective, which we have worked on hard over the last few months. What resources do we then need to solicit from premiers and the Prime Minister and Ministers of Finance to make that possible? But it's not focused only on dollars. Dollars obviously matter, but there's a lot more than dollars to do to support our healthcare workers mentally and physically and also organizationally in order to recognize and address the healthcare crisis that we're seeing.
Follow-up, the Ontario Dental Association has said recently that they don't know when coverage will start under the new federal plan. For the groups identified to be covered by the end of this year, when will that coverage start?
We have been, again, having another stakeholder, important partner meeting with a group of important partners on the dental insurance file yesterday. We've been having many of them in the last few weeks. We will soon be able to come to a decision based on that important input, and eventually, obviously, communicate that decision in due time.
Mr. Duclos, Mackenzie Gray with CTV. Saskatchewan yesterday joined Quebec in handing $500 checks out to all of the adults in their province. Your colleague Dominic LeBlanc has gone after Premier Legault on this issue, saying that, well, they couldn't be too serious about healthcare if they're handing out $500 checks. What's your opinion of this? Do you think these provinces are bargaining in good faith when they're handing out free money to the citizens of their province?
Well, there are two aspects to that conversation. I would call that a futile aspect and a useful one. The futile one is on dollars. Because as Minister LeBlanc pointed to, and as many have acknowledged, we have already met the 35% percentage that premiers have been asking the federal government to achieve. In fact, we have exceeded the 35% proportion during COVID-19, and we're back now at about 35%. So if we were to fight on percentages, no, some observers have said, well, there's nothing more the federal government should do because we've already achieved the 35% target. That would be wrong because we want to have a useful collaboration, not a futile debate on dollars and percentages, but a useful collaboration, a useful fight for healthcare workers in particular. And that's where all of that conversation, all of that collaborative work takes meaning. And therefore, I'm glad and not surprised, reassured, and certainly very pleased to have seen the conversations over the last few weeks, including yesterday, from premiers, Premier Ford in particular, recognizing that, yes, dollars matter, but equally importantly, actions and results matter. And it's in this context that we want our collaboration to keep being positive and collaborative. Because there's a ton of healthcare workers in Canada that look to us, governments, to see we can work together and share a positive and hopeful message to hundreds of thousands of healthcare workers that are finding it very hard to continue with passion and compassion to serve patients across Canada.
Is there any scenario in which your government would increase the Canada Health transfer to the provinces with no strings attached?
Well, you've heard the Prime Minister speak about this. We are focused on results. And in fact, when I speak to my colleagues again this afternoon, they will also agree that we need to focus on results. There's a separate conversation with finance ministers. That's not of our responsibility. That's not where I am an ally. I'm an ally on resources and results for my healthcare colleagues who do need that support from the federal government. The answer is yes. It's obviously been very central to our work with provinces and territories over the last few months in the context of this Pan-Canadian Healthcare Workers Plan that we need to support together. And second, it was in budget 2022. Minister Freeland announced $115 million to support the recognition of foreign credentials of approximately 11,000 people every year. So when we put that into actions in collaboration with provinces and territories, we can support again about 11,000 workers, including many nurses who would have been educated outside of Canada, whose credentials are not yet recognized. But if that were to be the case, they would be able relatively quickly to use their full potential to support patients across the country.
Question for Dr. Chapman. Do you, many nurses over the pandemic have suffered, they've become so burnt out. Some of them have already left the position or the profession. Some are planning to leave the profession. What's your message to those who are considering giving up on their nursing careers?
That's a very difficult question. I think it's been an incredibly difficult time over the course of the pandemic. We've had nurses doing end-of-life care by iPad, working critically short beyond what was ever imaginable. So first and foremost, my message is a message of thanks for those who have worked in various capacities over the course of the pandemic. I know it's been grueling and difficult. And I think I also offer a message of hope. I do believe it's a wonderful profession. I've been a nurse for over 19 years now in various different roles. And I think there's a number of different things you can do in nursing, and I really do hope that nurses who are in the profession find resources to stay, and I hope that we can make the workplace amenable to that as well, because we absolutely need all hands on deck.
Ici en personne, je passe la parole à Charlène qui va faire la période de questions par Zoom. Charlène, over to you for the Zoom portion of the question period.
Merci. Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Et sauf si je l'ai dit, veuillez identifier votre nom et votre média avant de poser votre question. We will now proceed to questions from journalists online with Zoom. If you're a reporter and you wish to ask a question, please use the hand-raising function. We ask that you limit yourself to one question and one follow-up. And unless I've stated it, please identify your name and your media outlet before posing your questions. So first, we have Émilie Bergeron from La Presse Canadienne.
Oui, bonjour, Monsieur Duclos. Ma question est pour vous. Vous avez dit en anglais qu'une décision s'en vient bientôt sur l'assurance pour les soins dentaires, qu'il y aura une annonce en temps et lieu imminente. Le scénario sur lequel vous travaillez, quel est votre niveau de confiance qu'il sera à la satisfaction là, du NPD avec qui vous avez une entente et qu'est-ce qui vous permet, si vous êtes confiant, de l'être autant?
La réponse simple, c'est qu'on travaille intimement ensemble depuis plusieurs mois. C'est un dossier que l'on sait être important, évidemment, pour les deux parties que vous avez mentionnées, mais surtout pour des millions de Canadiens qui ont présentement de la difficulté à accéder à des soins dentaires de qualité et abordables. Donc, c'est l'objectif principal. On sait que le faire, ça va avoir un impact significatif sur la santé bucco-dentaire de ces nombreuses personnes, dont les enfants de 0 à 12 ans dès 2022, mais aussi sur les conséquences de ne pas avoir accès à ce genre de soins de santé, sur l'hospitalisation de ces enfants, sur évidemment les impacts physiques variés d'avoir des dents qui ne sont pas en bon état, les impacts sur le diabète, sur la digestion, sur l'obésité, sur même le développement cognitif. Donc, il y a beaucoup d'impacts négatifs associés à une mauvaise santé bucco-dentaire et on a très confiance et on va avoir hâte de donner plus de précision que le plan qu'on va proposer dans les prochaines semaines va être non seulement à la hauteur des attentes de tous et de toutes, mais à la hauteur des besoins, des traitements là, dont les gens et les enfants en particulier ont besoin.
Et pour revenir sur l'annonce d'aujourd'hui, que dites-vous aux provinces qui pourraient y voir une forme d'empiètement dans leur champ de compétences alors que vous n'avez pas encore donné suite à leur demande pour une hausse des transferts en santé, une demande qui est là depuis plus de 2 ans?
Bon, 3 choses ici. La première, c'est qu'il y a déjà eu, il y a quelques semaines, une augmentation du transfert canadien en santé de 43 à 45 milliards. Ça va augmenter à 49 l'année prochaine, à 51, à 53. Donc, au cours des 3 à 4 prochaines années, c'est une augmentation d'à peu près 25 du transfert canadien en santé que l'on va voir, même sans tenir compte de la promesse du premier ministre d'en faire davantage. La deuxième chose, c'est qu'on a annoncé il y a quelques semaines à peine un investissement de 2 milliards de dollars en su de cette augmentation du transfert canadien en santé pour traiter des besoins urgents de réduction de toutes sortes de délais. Mais ces besoins urgents de réduction des délais, c'est d'investir essentiellement dans les travailleurs en santé. Ce sont les travailleurs en santé qui font la différence. Donc, ce 2 milliards de dollars, il est immédiatement disponible pour les provinces et les territoires. La troisième chose, c'est que quand on travaille ensemble, et je le fais à nouveau cet après-midi dans une rencontre avec tous mes collègues, on reconnaît tout le temps que les infirmières doivent avoir un rôle majeur dans notre collaboration, notre travail collaboratif d'appui aux travailleurs de la santé. 400 000 travailleurs de la santé sont des infirmières et des infirmiers. Donc, on reconnaît immédiatement que l'appui à ces infirmières et à ces infirmiers doit être au cœur de notre collaboration. Et mes collègues de la santé sont très heureux qu'il y ait au gouvernement canadien une expertise suffisante pour que je comprenne et que mon équipe comprenne l'importance d'appuyer les infirmières et les infirmiers à travers le pays. Donc, pour que cette collaboration soit fructueuse à l'échelle du Canada, il faut que tous les niveaux de gouvernement, y compris le gouvernement canadien, aient l'expertise nécessaire pour participer à cette collaboration.
Merci. Our next journalist, notre prochaine journaliste, c'est Mylène Crête de La Presse.
Bonjour, j'aimerais poser ma question pour Madame Chapman. Je ne sais pas si vous parlez français, première des choses.
Je parle un peu de français, oui, mais
Bon.
c'est mieux de répondre en anglais pour moi.
OK. Ben, je poserai ma question en français, puis vous déciderez si vous voulez répondre en français ou en anglais. Vous prenez un poste au palier de gouvernement fédéral. On sait qu'au Québec, présentement, à l'heure actuelle, il y a des infirmières dans certains hôpitaux qui font du temps supplémentaire obligatoire, des quarts de travail de 16 heures d'affilée. Alors, en quoi est-ce que cette position que vous prenez aujourd'hui va aider ces infirmières-là qui sont obligées de faire ce temps supplémentaire?
I will respond in English if that's okay. I think that it's a real conundrum to be able to go into work and know when you're starting your shift and not knowing when your shift will end and have that be mandated. And I think that we really need to work together with the provinces and territories on the conditions in the workplace because I can see that that is absolutely unsustainable. And especially 2.5 years into the pandemic, it just creates a condition that's ripe for burnout. So I really look forward to working with the provinces and territories to explore these issues more deeply.
Un suivi, Mylène?
Oui, excusez-moi, le micro s'était coupé tout seul. Ma deuxième question est pour M. Duclos. La campagne électorale au Québec est imminente. La santé, je pense que toutes les questions entourant la santé vont jouer un grand rôle. Déjà, le Parti conservateur du Québec propose d'introduire davantage de privés dans le système de santé, d'introduire une concurrence entre les différentes institutions de la santé au Québec. J'aimerais savoir qu'est-ce que vous pensez de ce genre de proposition.
Bien, vous ne serez pas surprise d'entendre que comme je l'ai dit tout à l'heure en anglais, je crois que le gouvernement canadien et le ministre de la Santé canadien vont toujours vouloir et devoir reconnaître que la gestion du système et des systèmes de santé au pays relève de la compétence des provinces et des territoires. Alors, c'est ce qui va se passer, c'est ce qui se passe généralement et c'est ce qui va continuer de se passer durant la campagne électorale qu'on va voir au Québec. Ceci étant dit, M. Dubé et moi et tous mes collègues avons toujours reconnu que la responsabilité était partagée, que même s'il y avait une différence de juridiction et de compétences de manière générale, on a intérêt et on a le devoir de collaborer ensemble parce qu'on sert les mêmes personnes avec les mêmes dollars et pour les mêmes raisons. Alors, c'est ce qui m'a animé au cours des derniers mois et ce qui va continuer de m'animer dans cette collaboration et cet appui aux provinces et territoires, peu importe le résultat des prochaines élections au Québec.
Merci. Now our final reporter will be Laura Osman.
Hi there. Thanks for taking our questions over Zoom as well. My question, first of all, is for the Canadian Nurses Association. You have been warning of the health human resources crisis for about a year at least, and providing really concrete immediate solutions to the federal and provincial governments. I'm curious what you think of the urgency that's been displayed by the federal government so far in dealing with the crisis that you now see before you in terms of the nursing shortage.
But first of all, thank you for the question. Naturally, we must fix quickly the working condition of the nurses across the country. Naturally, it could take, 6 months, a year. I know it's sometime. It's going to be a mid long-term solution, and it's going to need to put in place multiple intervention. It's just not just one intervention, and it's also about retaining nurses, recruitment, also bringing back the one who left the healthcare system and make sure that they work in a healthy work environment. That is what nurses are asking now. It's working at the full scope of practice and having support from the mental health. And I could talk to you about big sheets with all solutions, but naturally we know that it cannot be fixed in one day. That's going to take a long time road, but at least we're going to move forward, and we're going to work closely with the new chief nurse officer federal level. And I just hope also that the chief nurse officer level will, at the federal level, will also work with the provincial chief nursing officers to resolve those nursing issues across the country, because it's for the sake of the healthcare system, and we want to make sure that we keep a sustainable health system across the country. Thanks.
Thank you. And for Dr. Chapman as well, I'm wondering how you plan to elevate the voices of, places like the Canadian Nurses Association, other nurses unions who've been sort of ringing the alarm bells for quite some time now. How exactly do you expect to be able to platform those concerns?
Right now, and this is a really important role to have a federal voice for nursing, or a nursing voice at the federal level. And so I really hope to work very closely with the provinces and territories, as well as the national associations, to really amplify the voice of nurses. The work has been underway certainly at the provincial and territorial level with Health Canada for some time, but without a chief nursing officer. So I'm really hoping to be able to advance this work in a meaningful way.
Thank you. There's no more questions on Zoom.